Good evening and welcome to Hope for Healing. I'm your host, Dr. John Stracks, joining from my office in Chicago. I'm a physician who focuses on the reduction and elimination of physical symptoms using mind-body medicine methods. If you'd like to learn more about my practice, I do practice telehealth, and my staff would be happy to talk with you about our services. You can find more information out about that at our website, www.drstracks.com. This Hope for Healing videocast series is one of many joint efforts between me and the folks at Curable. For those of you who are not yet Curable users, Curable is an amazing app that offers science-backed techniques for chronic pain recovery. They and I have been working together for about 6 years now, and we created this video series because we want to help people in pain understand the connection between what's happening in their lives and what's happening in their bodies. Today, my guest is Anna Holtzman, who is a chronic pain recovery therapist and coach based in New York City. Before starting this career, she had a separate career in reality TV for over a decade, and during that time, she started getting migraine headaches. She'll share more of her story in just a second, but then she went back to school to become a therapist. The migraines became even more frequent. And at some point, she discovered mind-body medicine healing methods using the Curable app. And now she supports her clients with those same tools that enabled her own recovery. She's also a facilitator for the Curable Groups program. Anna, welcome to Hope for Healing. I'm super excited to be here with you and hear more about your own healing story and how you've now used those techniques with your own clients. So thanks for being here.
Thanks so much for having me, Dr. Stracks. I'm so happy to be here.
I'm so glad. So as you know, we talked to a lot of people on this series, many of whom are practitioners in the field and became practitioners in this field because they had their own symptoms that they found would go away. This way, I am an example of that. You are an example of that too. Would you be willing to talk a little bit about sort of how this developed for you with the migraines and then the worsening as you were in the midst of switching careers?
Yes, I would love to. So one of the things that I think is maybe interesting about my particular pain story is like a lot of the clients who come to work with me, it takes them a while to connect their physical pain with emotional stress. But in my case, it was very, very obvious and clear to me straight from the beginning that the migraines were a stress response. So the first time that I ever got a really bad headache was on my very first day of work on the very first reality show that I ever worked on. And it was just like mountains of stress. It was not only was it my first day working in that particular professional capacity, it's an innately very high stress and very fast paced industry. And I was, there were like a few different softwares that people used in those days for editing, and I was using the one I was least familiar with. And so, it was just like a crippling amount of stress that I was feeling that day, to the point where I couldn't talk and I couldn't function. And I was really in like a freeze up mode. And on that first day of work, I got just this massive headache, which was not something I had experienced before. And I remember just walking out of the office and walking blocks and blocks because I wasn't familiar with the neighborhood, trying to find a pharmacy, looking for migraine medicine, which I'd never taken before. So it was a no-brainer to connect the stress with pain.
And you were able to see that because not everybody, even when it's so obvious, is able to do that. But you were able to see that this is an incredibly stressful moment, and it was there in the form of a migraine.
Yeah, and I kind of I'd had anxiety experiences before that. Like I knew I was anxiety prone ever since high school. That was kind of a thing. So I was familiar with the fact that I was feeling anxious. But yeah, that was the first really bad headache that I experienced. And then I worked in television for just over 10 years. And I continued to get headaches, but they were very far and few between in the beginning. Mm-hmm. And took really a few years for them to become more frequent, more of a regular thing. It was years after that first experience that I actually went to a neurologist and got a prescription, medication to take. Sorry if you can hear this dog that's barking outside my window, yeah. But so
that's New York City.
It's New York City. Yep. And then, yeah, toward the end of my 10 years in TV, it was like a pretty predictable thing. It would happen when I would get really stressed at work. And there were days when I had to just close the door to my edit room and lie down on the floor, take some medicine, lie down on the floor, wait for an hour for it to pass.
And did you still think of them as stress produced, or had they become sort of somewhat mysterious and not clear why they were, or maybe both?
Yeah, well, yeah, to me, it was very, very clear. And here's another example where my story is maybe kind of the inverse of a lot of people's stories, where a lot of clients who've come to me, they've been to a lot of medical doctors already seeking a physical cause. And for me, it was a little bit the other way around. So I'd been to a neurologist several times, and I'd also started to see a therapist at that point, not because of the headaches. I hadn't really made those kind of connections where I would say I'm going to a psychotherapist for headaches, but I was seeing a psychotherapist for, to do emotional work. And she happened to have a mind-body approach. And so it wasn't the main focus of our work by any means, but we would talk about the connection between mind and body in relation to headaches. And I was very, very much open to that. I've always been open to holistic approaches. So when I would go to the neurologist would want to give me more there was one neurologist I saw. I had to hop around because of changing insurance, like everyone has experienced. And one really was adamant that I needed to get a brain scan. And I actually refused it because I was like, I know, these things happen when I'm stressed out. There's not a physical thing going on here. Yeah. And so my frustration was trying to convince the medical doctor I was seeing that this was stress related, which I think she was open to, but she didn't really have any tools to, offer me in that regard.
And I think that's true of a lot of physicians. And I know I hear all kinds of stories about what happens when people see physicians when they're in pain. But I think there are a lot of physicians out there who understand the connection between mind and body and understand that stress can cause symptoms, or symptoms can be a result of non-physical causes. But the language they have is so rudimentary that it doesn't work. They don't know how to talk to people about it, and they don't know what to suggest either.
Absolutely. Yeah. And this may be a little bit getting ahead of things, but both the medical doctors that I was seeing at the time and my psychotherapist, who had this, more holistic approach, the things that both of them were recommending were all just only about the soothing, like meditation, things that calm you down. Yep. And it wasn't until I found Curable that I discovered oh no, you need to get your fight response working in order to make a difference with this stuff.
Yeah. And I do want to talk with you about what you do in that regard with clients as we go on. But anyway, so back to, they're getting worse. You've seen a neurologist, you probably had, or you were offered a brain scan. And then at some point, did you start to think about switching careers? Is that when things really came to a head?
Yes, which was initially completely, again, unrelated to pain and headaches. So I'd been working in television for 10 years. I never intended to spend 10 years working in reality TV. Like a lot of people, I'd gotten into it because I wanted to be an auteur and make independent films, and never figured out a way to make money doing that. And so after 10 years in reality TV, I was like, I gotta reassess my life here. This is not where I want to stay. No shade to those working in reality TV, but anyway. And I'd been in therapy for quite a few years at that point and was finding it very, very helpful and also very interesting. So I thought, maybe this could be a career path for me. And it took a long time for me to figure out how to make it all work. But I eventually decided I did leave television and I went back to go to grad school for mental health counseling. And because I was familiar with the mind-body approach, and I knew that my headaches were stress related, and I was also starting to connect them to like early childhood trauma at that point because of the work I was doing in therapy, I had this theory, which makes me laugh now in retrospect, but I thought, when I go to grad school, I'm going to be in this environment where it's all about, allowing feelings to come out and to talk about them, and like you don't have to hold them in and just like work like a maniac all day. And so I thought, I'm going to go to grad school and my headaches are going to go away. And the big joke was on me because the headaches were a problem at that point, but they hadn't taken over my life. I was going to work and all that stuff. But when I got to grad school, the headache started to like really take over. And by the time I was getting ready, the end of grad school was in sight, the headaches had taken over so much. They'd become so frequent. It was like 2 to 3 times a week, I was getting a debilitating headache, and I'd have to miss days at my clinical internship. I was seeing coaching clients on the side. I was having to cancel on people. And so I was thinking, I've just put all this time and money into this education. Am I actually going to be able to have a career? Like I'm
Right.
pretty dysfunctional.
And for those who are listening who haven't been to psychology grad school, it's not usually super welcoming of feelings and exploration, and for better or for worse. And I remember in medical school, I went into medical school knowing about this. And so I'd had a big health crisis in the process of applying. So by the time I got to there, I knew about it. So I had a little bit different language. But I remember for the first couple of years, like constantly feeling, I think I would describe it as like my head hurts because I'm trying to stuff all this knowledge into it and it doesn't quite fit. And I was lucky to have the language so it wasn't actually a headache, but it was just this feeling of discomfort of trying to learn these things that I didn't know and couldn't quite understand, and sort of always be a little bit off balance trying to get something new to be memorized by my brain.
Yeah. And the way that I describe the experience now, and there were a lot of wonderful teachers in grad school. And there was also a lot of material that was very like medicalizing that I didn't relate to, that felt triggering to me. Yeah. So the way I described the experience in hindsight was that I came in with my emotional pump primed. Like I was kind of had all these expectations that my emotions would be allowed to come out and that it would feel safe for them to come out. So it's like I filled up my balloon of emotions. And then when I got there, I was like, oh, this environment feels stressful in certain ways and it doesn't feel safe. So it's like this big balloon of emotions, and then holding that in, and the tension just, would manifested as a lot of bad headaches.
Yeah. And so then at some point, as you were going through grad school, at some point you learned about mind-body medicine, or you picked up the Curable app. How did that come about?
Yeah. So things had gotten to, a point where I was really worried about what's my life going to look like. And I needed to get my prescription for headache painkillers refilled. And I went to yet another new neurologist because now I was a student. So I went to the student health clinic, and that particular person who, was very well-intended and also very old school said, oh, now that you're getting this many headaches, per month, you're kind of like beyond the number of pills that are allotted in the, monthly emergency meds. And so I really recommend that you go on daily medication. And I was like, I am not going down this path.
You can swear. It's okay. We encourage swearing here. So
yeah, I was like, hell no. This is not where I'm heading. Yeah. And so I was just like, thank you very much. No, give me my regular prescription and I'm going to go figure this out by myself. Mm-hmm. Which I never really thought about this particular thing before, but I think that moment of saying like, I reject authority. Mm-hmm. In this moment, I'm saying, you know what? I don't trust this, even though this is like a very like established path. Like I'm going to go my own way and trust myself and find my own answer. I've heard so many people describe a similar turning point in their own recovery process. And I think it was that way for me as well.
Yeah. A lot of people will describe pain as the brain's reaction to danger or perceived danger. And what I say regularly, because I think it's true, is that there's nothing as dangerous as the medical system in all of this. And that's a really nice example, right? You go in, you're trying to get help, and somebody says to you, now you've got a chronic disease so bad that you have to take medication every day, and probably either explicitly or implicitly, and there's nothing else you can do. And I'm just so happy for you that you recognized that that wasn't true. Like you knew somewhere, and
I was like,
really close to the surface, like that is not where you're going.
Yeah, I mean, talk about the fight response that I brought up earlier. Like my fight response came totally online. I was like, no, this is not for me. I am not doing this. I'm rebelling. So of course I went home and probably went crazy on Google, looking for other answers. And as the way the algorithm works, because I was now Googling, as I'm sure everyone watching can relate to, I then, got an ad on social media for Curable. Maybe it had come up before, I don't know, but I was tuned into it at that moment. So, I clicked on it and went down into the rabbit hole and downloaded the app. And as soon as I started listening, everyone chooses kind of a different path in Curable, which I love. And the thing that I zoomed into were the I forget what they call it in the app, but it's the psychoed modules.
Yeah, psychoeducation. Pain science education.
Yeah, I binged all of those in a very short time.
Yeah,
and I was like, it's like the heavens parted. I was like, this is the missing link. Like everything I've been learning about mind body and my own therapy experience, when I add this in, like I can see how this is now like the puzzle pieces are coming together.
Yeah. And so what happened from there? I think, when I tell my story about what happened to me, and this was almost 25 years ago now, and, 9 months of pain and nobody could figure it out. And then like I reread Dr. Sarno's book, and many people have latched on to Dr. Sarno's work over the years. And and I went out the next day and I got on my bike, and for years I told the story and then I was better. Like I came home and I was better. And then I was preparing for a talk, I don't know, 10, 15 years ago. And I came across the journal that I kept in the aftermath of that. And like for months, I was like, I don't know, is this right? How do I know? Nobody's examined me. And so even in my memory where it's like, oh, and then I was better, it took a while to really set in and for me to figure out how this all works. I don't know what your experience was with that.
Yeah. So my experience was different from that. It was definitely not like all of a sudden no pain. And I think maybe my story is more of a common one, because for me, it's been like a much more gradual process and with many different phases and stages to it. But I did see some changes pretty quickly. And so that, I had a lot, like I already had buy-in because I already liked just the vibe of the whole idea. Yeah. But I also was seeing some results. I think it's hard to really remember the timeline of it specifically, but I think that within 3 months, I think 3 months in, I had a month of 4 migraines instead of usual 8 to 13. And I did have a moment of like, this is it. I'm done with migraines. It's just going to go down and down each month, and then I'm done. And that's not really how it went. But, it was very encouraging.
Yeah. And I want to hear about how you made the transition to practicing this as well. For those listening who, a lot of people are listening because they understand the concept, they've been practicing, and they're still not feeling well. Is there anything you can remember from that time period where you first started learning about this that was very specifically helpful for you? Any strategies that you used, any ways that you thought about that you think may have contributed to some of that improvement you saw in the first few months?
Yeah, definitely. I think there are three things that come to mind for me. And of course, they may not be the three things that will make the difference for some other person, but I think the three things for me was one, getting a different intellectual framework for what is pain, understanding through the Curable teachings that that pain is like an SOS signal. It's a danger signal. It's an I don't feel safe signal. Mm-hmm. I was like, okay, so I don't know how to make pain go away, but I do have some ideas about how can I help myself feel safer. So this is a much more straightforward thing for me to start figuring out. Mm-hmm. And just having that framework was settling and calming. It's like, it was no longer like, I don't know what's going on and these headaches are chasing me. It was like, okay, I feel stressed out. This, like, it was also, I was like, why didn't I figure this out before? Because this immediately makes sense to me.
And I think that, I say it all the time, the concept is generally non-intuitive. Like, we're human beings, we're linear thinkers. If something hurts, we think that, what's physically making it hurt. But to your point, once you have this model of, oh, there's not something wrong with my brain, it's that I feel unsafe. And then, as you said, like, you have skills, or you had skills at that point about what to do, or at least what to try when you don't feel safe.
Yeah. So it was that that thinking shift, that intellectual shift was very key for me.
Yeah.
A second thing was one of the Curable thought exercises. And I know this one's been very helpful for a lot of other people as well. And it was to start replacing, in my own mind, in my thinking, to start replacing the word migraine or pain with a silly word, a word that's not frightening or triggering. And the word that I think was suggested by Curable was bananas. So I just took that and ran with it.
Yep.
And like, that thought exercise made a huge difference for me initially. That didn't wind up remaining a powerful exercise for me, but it was, there were different things at different stages. And initially that was a really helpful and effective one for me. And the third thing that was also initially very helpful for me was another Curable exercise that was in the panic button section of the Curable app. And it's like tracking, it's connecting with your emotions. So it's something like an exercise where you just, get into a meditative state and ask yourself, what am I feeling right now? And putting a name to the feeling. And just that, putting a name to the feeling, in those early days for me, I'd have this like big emotional release. That exercise, again, like, it wasn't the same exercise that stayed potent for me over time, but initially I'd have this big emotional release and my headache would actually sometimes disappear in that moment. And that felt very magical. It's like, whoa, I have power here.
Right. We had a staff meeting yesterday here, and that's what was the subject, was the role of emotions in all of this. And, emotions are, I just think, so scary for so many of us. And there's this data out there that says that naming the emotion, what you just described, will calm down the amygdala, which is an area of our brain that's responsible for emotional processing. And when we calm down the amygdala, we can calm down the sensation of pain that we experience. And so there's such utility in learning more about emotions, studying emotions, using emotional language with ourselves and with other people. And I think it's really scary and difficult for people who don't have that encouragement when they're young. But I just think it makes such a difference.
Totally. And this, again, I might be jumping ahead a bit, but something that I really love to reinforce with clients is, of course, you're scared of emotions. Like, our culture has taught us that emotions are bad. We're going to get in trouble if we're too emotional. Like we've had a lot of fear conditioning. It's not like we're born afraid of our emotions, but we've been told not to express them over and over again in so many different ways. So how could you not be afraid of them? Like there's no shame in that. It's totally normal.
Especially if you're female, right? Being told, not to be over emotional or to keep your feelings inside. And for men too, right?
I would say maybe even more, it's in different ways, but it's pretty intense regardless of your identity. Yeah.
And so this was all in the process of you studying to become a therapist and become a therapist. And so when did you first feel like you wanted to work with people in this way?
Yeah, that's a great question, because I'm thinking about it. I don't remember like a specific moment, but it was more like a gradual process as I became more and more, as I started to experience more shifts. And I was very excited about that because obviously like it was making a huge difference in my life. It was such a great thing. And so when you experience something that feels really wonderful and exciting for yourself, you just want to share it with other people. And that's been really interesting too, that like, as I gained more confidence, I felt more comfortable working on this stuff with clients. And something that was a big challenge for me earlier on was I was like, oh, I better, like, if I don't get rid of these migraines completely, then I'm not going to be a good therapist. And that thought was a huge pain trigger, I discovered.
Absolutely. Yeah. And I think that's common. And I've heard that from a number of other practitioners that you feel like, you're cheating somehow, or you're being a fraud. And I have found it interesting over time. When I first moved back to Chicago, I've always been interested in this work. And so I put together these panel discussions where people would talk about their experiences. And for the first couple of years that I did that, more or less, I could only get men to speak on the panels, even though I had plenty of female patients who had done quite well. And so after a few years, I started asking my female patients who were doing well and didn't want to speak on the panel, like, why not? And it became clear to me that they felt like if they weren't 100% cured, then they shouldn't be up there talking about their experience. And so once I recognized that and could name it, then I could explain to people like, 100% is never the goal. Like, we're human beings. There's always going to be part of us that's reacting to what's going on around us. And the important part is that people are doing a lot better and have learned skills. And so people who felt like they were 90% better, 80% better, or 50% better started feeling comfortable going out there and sharing this knowledge. And I think it's the same when we're practitioners, that 100% is never the goal. The important part is that we've had these experiences, we can share these experiences and this knowledge that we've gained.
That's so interesting to me to hear, like the gendered way that it played out. It's interesting because I also work with people of all genders, and maybe it's something about my vibe and who I attract, but like across all genders, everyone who winds up working with me, they all have these perfectionist tendencies, which I can totally relate to. So
yeah. And so at some point, people started coming to you specifically for this, knowing that this was in your wheelhouse. And so I think you see people for pain, you see people for mental health issues. Obviously, there's crossover between the two. What kind of things would you do when you meet somebody for the first time? And so we're going to talk about some of the techniques and strategies that you use, keeping in mind that we've got people listening who maybe would love to work with a therapist or with you, but can't for a whole variety of reasons. They don't live in a place where there are mind-body therapists, or they can't afford it, or it just doesn't, they're too, schedule is too busy or whatever. And so thinking about the process of what happens when someone comes to you for an intake, and then the tools that are useful, especially in regard to what people can maybe bring into their own lives, even if they don't have the opportunity to work with a professional in this.
Yeah. So this question of like, how do we start off is like everything. It's a continuing learning and discovery process for me. And what I have found so far is that initially, when I started to do this kind of work, I was so excited about all of the tools that had helped me to make shifts in my own pain recovery. So like the thought, the thought tools and and journaling has been a big one for me. And I just like wanted to throw tools at people like right away. And what I'm continuing to discover, and a lot of times clients come to me and they're in the emergency feeling mode and they want tools as well. They're like, I want steps and tools and blah, blah, blah. And we'll certainly get there. But I've found it's, this is like, of course, but it's just so important to slow down in the beginning and establish a relationship, establish the trust, because pain, it's just like one of many different expressions of a stressed out nervous system. And a stressed out nervous system is like a very tightly wound spring. And it needs an environment of safety, of feeling safe in which to start unwinding on its own. Of course, there are tools that then we'll bring in that can be helpful to give that spring directions on how to unwind. But it's that like slowing down safety building process that is so important to start out with. And like, it's an ongoing learning curve for me too, because I can get swept up a little bit in the emergency mode of like, oh yeah, you're in pain. Like I need to throw tools at you, but it's really important to slow down. And
yeah, our West Coast colleagues, Dr. Hanscom and Les Aria and Dr. Clausen out in California and Washington, they sponsored a pain summit last weekend that I've been listening to. I'm listening to the recordings, and Dr. Hanscom was pointing out that there are so many of us around the country and really around the world at this point who do this work, and we all have slightly different takes on it. And the language that he uses is different than the language that I use, different than the language that you use. But the commonality there is that we're able to create this safety for people in the relationship. And you and I were talking earlier about how dangerous the medical system can feel for people and how much shame there is and how much dismissal there is. And so I know that you and I and others work really hard to create that connection, to listen, to convey that we care about the people that we're working with. And it makes such a difference in calming down the system. I had a patient who was here a couple of weeks ago who was having a flare up, and he made the appointment. He came on he called on a Sunday, I think, and we made the appointment for on Monday. And his comment was that, like, he started feeling better as soon as he called, which we all have that experience, right? We go to see a physician, and then by the time we get there, the symptom that we went to go in for isn't there. And when we think about it in terms of this danger and safety lens, it makes total sense that we're getting somebody else to help hold on to it. And once that feels safer, the brain can relax and the symptoms can calm down.
totally. Yeah, absolutely. And I know like the second part of the question you had asked is like, if a person is unable to access therapy, what can they do on their own, which might feel like a very confusing question. Like if I'm saying and you're saying like it starts out with building a relationship that feels safe and caring and trusting, it could be confusing, like, okay, well, how do I do that on my own? And I've got to say, for myself in my own process of pain recovery, absolutely the most effective part of it in the long term has been building that relationship of trust and safety with myself. And that could take place in, an infinite number of different ways for each unique person. For me, expressive writing or journaling has been a tool I've really eventually gravitated to. I was very avoidant of it for the first year that I was, on this journey. But once I got into it, it became a way for me to sit with myself and take time with myself and, be patient with myself, sit there with the feelings and tend to them through, dialoguing on the page.
Yeah. And I think, there are so many people who find that the journal writing is useful. And, one thing that I say regularly about the journal writing is that occasionally people will not respond well to the journaling, or they'll be scared of it, like you said. And most of the time in that situation, it's because people are attacking themselves in the writing, talking about how slow they are at this, or they're not going to get it, or whatever else. And so it becomes this additional tool of danger that we have to get away from. And so it's one of the rules that I give when I prescribe journal writing to people, is that if you find yourself attacking yourself, you have to move away from that, because the goal, as you said, is to create a sense of safety, not more danger. I'm a big fan of the work of Lorimer Moseley down in Australia, who a lot of people have read and looked into. And they've got this concept of DIMS and SIMS, which is danger in me and safety in me, in all kinds of different categories, people and places and relationships and thoughts and emotions and experiences. And so one of the assignments that we'll give out is for people to start thinking about it in those terms, in these various categories. Where is the danger and where is the safety? And then you can start to think through, even if you don't have a professional you're working with, if these things are dangerous, if this place that I go is dangerous, what can I do to make it less dangerous, or to replace it with something that's safer? And it's a nice systematic way to think through that and start to change that balance for people.
Yeah, I like that.
Yeah. So some of the tools that you do use, or some of the techniques, and I know that you have a number of them at your disposal. A couple that I'm particularly interested in exploring just a little bit here. One is internal family systems. And I know that there are a lot of people who do that work, or listening, who have heard of that work. And it's frequently referred to as parts work. And so let's talk a little bit about what you do in that arena and how you found it helpful for people that are exploring this.
Yeah. So parts work has also been hugely impactful for me in my own process. And it's something I use with clients. And it's something that I bring into expressive writing. Sometimes I'll start out just to kind of give people a framework for, like, what is this parts work thing, is just to say, like, we have all got different parts of ourselves going on, and the different parts sometimes are in conflict with each other, which can create a lot of internal tension, emotionally, physically, et cetera. For example, like, one, I think, very relatable kind of example is, like, if you're at a stressful job, there could be one part of you that really wants to tell your boss to F off, and just, like, blow up the situation. And another part of you that's like, I really need this job. I need to keep paying my rent, and I really don't want to make waves. And so, like, to those listening, if you can imagine, like, what is the feeling inside your body of the part of you that wants to tell everyone to just get lost, that feeling of explosiveness inside your body that wants to get bigger, like, imagine that feeling. And now imagine simultaneously, what's the body feeling of wanting to stay small and stay safe and keep your job and not make waves? That's kind of going like this. And how do those two feelings feel in your body when they're happening simultaneously? It's like a lot of tension. when sustained, could be very painful.
Absolutely. And I think everybody has those experiences, whether even we recognize it or not. There are a lot of instances where we're sort of trying to move in two directions, two different directions at the same time. And so I agree with you that that's a natural human trait to have those various competing interests in our mind. And so then how does the parts work help to sort that out for people?
Yeah, so the way that I approach it anyway, and it's sometimes through conversation, but if the client's open to journaling, I really love to use that as a tool here, is to invite the client or myself, if I'm doing this work myself, to invite myself into the role of like a couples therapist for my different parts. Mm-hmm. And it's like, well, the couples therapist wants to engage in conflict resolution. So the first thing that needs to happen is that each of the parties needs to feel heard and seen and cared about, and for their feelings and concerns to matter. So we're going to like talk to them one at a time so that they're not, talking over each other and invalidating each other. So I might first, like if the situation I just described is my situation, I might first do a journaling session with the part of me that I usually start off with the part that's most frightened. So I might start off with the part that's like, I need to keep my job and stay small. And I'll ask that part on the page, like, dear part that wants to hold on to the job and stay small, what emotions are you feeling? What would you like me to know and understand? And what are your concerns and fears here? And just to like hear them out and say to them like, oh, wow, that's totally understandable. Like, I completely get why you might be feeling that way. Thanks so much for sharing that with me. Mm-hmm. And just leave that there. Mm-hmm. And then, after taking a break from that, go over to the part that wants to like just blow shit up and tell everyone to get lost. Mm-hmm. And ask them the same questions, like, what emotions are you feeling? What would you like me to understand? What are your concerns and, fears or whatever in this situation? And get a sense of those and, offer those compassion and acceptance. And it's like already the temperature in the room with these two parts has come down a lot.
Mm-hmm. And are there other parts that you frequently see in people? So a part that sort of like wants what it wants when it wants it, a part that really wants to keep the status quo and be protective. Are there others that frequently surface as you work with people or even as you think about yourself?
There are certainly, like, there can be so many different parts, mm-hmm. but I would say that in the work that I do with mm-hmm. chronic pain specifically, it so often boils down, like in essence, mm-hmm. to the part that wants to be big and the part that wants to be small. Mm-hmm. The mm-hmm. part that wants self-expression and like thriving and, life force to come out, and the part that wants to maintain social acceptance and, not rock the boat. Like mm-hmm. those are usually the two parts that seem to be in conflict mm-hmm. Mm-hmm. in the way I see it anyway. Yeah. But there's also a different format of dialogue that I think can be gone into and go even deeper once that conflict temperature has come down a little.
Once each side has the opportunity to be heard, then you can go further in the discussion. And that's when you think about marital therapy or couples therapy. Same totally. Thing, right? If everybody's heated and going at it, then like it's not a really good time to explore deeper past wounds or anything else. And it does sort of bring up another topic that you and I have discussed in the past, which is self-compassion. And so, recognizing that these parts are there and giving them space to be heard. And you and I have talked about this, and I say with some regularity that like we can be mean to ourselves or we can heal, but it's very, very difficult to do both. And when you think about teaching people about self-compassion through the parts work or other, what are some of the things that you encourage people to do so that they can hear these parts of themselves without saying like, that's ridiculous, don't be a baby, calm down, this isn't an emergency, or whatever else we say to ourselves?
Yeah, absolutely. Yeah. So it's like when the conflict thing has come down a little bit, that's when we can go into this self-compassion work, or we might call it inner child work. And I use the language, like I'll shift out of the kind of couples therapy language and come into the parenting language, because this part is really about how are we self-parenting ourselves? Are we self-parenting ourselves in the style of a drill sergeant where we're yelling at ourselves all the time? And in chronic pain, like oftentimes that is what's going on. We're yelling at ourselves all the time. And it's like the mind is yelling at the nervous system. And so the nervous system is staying in fear and freak out. That could be one type of self-parenting that's going on. Another style of self-parenting that might be going on could be the overprotective self-parenting. Are we saying like, yes, the world is a scary place and you're not capable of thriving in it and you should stay home and not do anything? And the nervous system will say, oh yeah, I'm not capable of anything and the world's a scary place, so I'm going to remain frightened. And oftentimes with chronic pain, it's like either one or the other of those is going on, or it could be like vacillating between those two styles. And so my work then is to invite the client into a different kind of self-parenting, which I would describe as kind, confident, and encouraging. It's like the type of little league coach that you would hope your kid gets. And bringing that into journaling and like parts work journaling, there's a format of journaling that I use where it's written like a dialogue form, like as if you're writing the script to a play. So there's the adult self and the inner child, or you could pick different names if you don't like those. And the adult self starts off by saying, I'm right here, little one. I love you. What are you feeling? And then the child's allowed to answer whatever comes out. And oftentimes the first answer is like, I don't want to talk to you. I don't trust you. And then the adult's like, I totally understand why you would feel that way. I love you. Is there more? And things may start to soften as that dialogue just continues back and forth.
Yeah. And so it's really channeling these sort of calm, comforting, like you said, little league coaches that do that are encouraging and supportive and non-judgmental. And lots of us didn't grow up in situations where that was the case. And so these are new skills that we're learning, but I think so important to allow all these pieces of ourselves to have voices and not feel judged, because it's when those voices get to be heard and get to speak freely that we can start to sort out what to do about it. I had a patient one time who was struggling, and we were talking about being able to listen to herself and get information. And she's like, I do that. I was like, well, what does it sound like? And she says, I sit down and I say to the migraine, like, come on, I've got 60 seconds before my next client. Just tell me what's going on and we can fix it and keep going. And I was like, all right, I think I see the issue here. How do we, like you say, slow it down, create a little bit more space and allow some of these voices to come out in their own time, not sort of in the time frame that we necessarily want or need them.
Yeah. And I'm like laughing, not because I'm like, oh, that's so ridiculous, but because I completely recognize myself.
Yeah, for sure. That. For sure.
And when I came to the point in my own like path with this stuff where I was like, oh, I think there's something going on here. Now I'm talking to myself. what I decided to call that was hurry up and relax right now, damn it.
Yeah, exactly. Exactly. Right. And then there's that cartoon, right? Nobody in the history of the world has ever relaxed after being told to relax.
Yeah.
Hey, we're going to start winding down in just a minute for time reasons, even though I would love to go on indefinitely. But thinking about sort of some of the holistic nature of what you do and the recognition that there's a lot outside of ourselves that contributes to symptoms. And so when you think about social or cultural aspects of healing, how do you pull that into conversations with people you're working with?
Yeah, so I know I touched on this earlier, but like something that comes up for most of us, and certainly most, myself and most of my clients, is when we start to recognize like, oh, I've been suppressing my feelings, like we can get really hard on ourselves for that because we're like, oh, now I know it's not good for me to suppress my feelings. Like, why have I been doing this? This is so terrible. And what I find really important to bring in is like, hey, this is cultural training. Like we've all received, whether no matter what kind of parents we had, we're in this greater cultural context where we've all been trained to be obedient. And being obedient means not listening to our feelings because our feelings are very inconvenient to obedience and rule following. So, like, just can we keep that in mind? Can we keep in mind that we're doing exactly what we've been trained to do? And now we're starting to discover that that training we got was not very good for us. So it's going to take really some work to recondition ourselves. And it can feel really dangerous because if we've been trained that you're going to be socially rejected if you don't stay in line and follow these rules, it could feel dangerous to start trying to find your way out of that. And that's completely normal.
Yeah, I did an interview with a patient of mine named Jill Rydell a couple of years ago now, maybe a year and a half ago. And one of the things that Jill talks about in terms of her migraines is that she came from a family of migraineurs. Like it was just the family business. And she sort of has this memory of being 18 and getting her first migraine and feeling like, okay, now I'm really part of the family. And I think up until a certain age, and that age can be quite old, it's super important for us to be part of our family. And if we're young enough, right, it's life or death. We have to fit in with the family because if we get cast aside, we can't survive on our own. And so Jill went 35 years having, migraines 3 and 4 and 5 times a week. And she also simultaneously, like she moved away distance-wise and started to move away a little bit culturally from her family. And by the time she learned about this, she recognized like, oh, I don't have to be part of that part of my family anymore. Yeah. And at that point, it was a pretty easy step for her to say like, oh, I can have a different reaction when the migraine starts than I've been trained to do. And so I think about that regularly too. Like, how do we have to fit in with the culture around us or the family that's there with us? And at what point does it become safe to start to step out of that a little bit and tries to do some things differently or have a different reaction to those sensations or bananas in our bodies?
Yeah, I can actually really relate in my own way to that story you just told. And, now working as one of the facilitators for Curable groups, I think that's where it can be so, so helpful to do this work in a group environment. I participated in one of your groups that you run.
Yep.
And it creates a context of safety in which to try out this new stuff.
Mm-hmm. And just before we stop, the work that you do as Curable group facilitator, anything that you find particularly helpful in that group environment, or any thoughts about, say, people who do participate in those groups, how they can maximize the effect for them?
What seems to me to be most powerful about those groups is just people having the opportunity to discover that they're not weird or different or broken or alone. You know, there's such a diversity of different personalities and life experiences, and yet everyone can relate to each other so much. Yeah. Like, oh my goodness, like that person feels so similarly to me. And it's just such a relief to find that out.
Yeah. And pain and symptoms and disease is such a lonely place to be. And I hear that comment from people all the time, that it's so relieving to be able to talk about this in a place where they're not going to be rejected for what they say. And then, as you said, not only that, but have other people say like, yeah, I've had that happen as well, or I can totally relate to your saying, or thank you for bringing that up because I've been worried about it and I've been afraid to say it, or whatever else happens in a group dynamic.
Yeah, just to add like one more little piece onto that, something that I hear a lot from participants, and I experience it myself in those groups, is that when we hear other people describe their struggles, the compassion we feel is so automatic. And that it's like, here's the compassion. Oh, and I can like give that back to myself now.
Right. And as we're talking about how important self-compassion is, being able to model it towards other people and then sort of reverse that and send it back to ourselves. I agree. Anything else that you'd like to say or remind the people who are listening and having successes and having struggles and trying to figure out how to walk this pathway towards feeling better?
Yes. The thing I would say is that the healing process is in many ways very similar to the creative process. And like with the creative process, if you're in a mode where you're like pushing and pushing and pushing to get that next breakthrough, it's not going to go very well. It's the time to step away. The best ideas often come to me when I'm in the shower, and the same is absolutely true of this work.
Right. Sometimes we have to try softer in order to move forward, and trying softer it's a difficult concept for most Americans.
Yeah, I took that phrase from you and I've shared it with a lot of my clients, to try softer.
So anyway, so as we finish up, we had been talking about the Curable groups and the Curable app, and we do sponsor this with them. There are a few different exercises in Curable that relate to what we've been talking. They have a really nice self-compassion meditation, and they also describe the dialoguing techniques that we've been talking about with the parts and bringing in various aspects of ourselves. And so they should be able to write that in the chat for specific instructions, but those are there in the apps. So Anna, so delightful to be here and share this time with you. Thank you so much for sharing your wisdom and your experience and the strategies you use both with yourself and with the clients that you work with. I know how much people appreciate it every time somebody comes and shares this with people who are working on this. So thank you.
Thank you so much, Dr. Stracks. Thanks to you and to Curable. It's such a pleasure to be here, and you've been a big part of my healing journey, so I really appreciate you.
Great, thank you, thank you. And as we wind up, I'm always reminded how glad I am to be part of this community too, both with other practitioners and people who are walking this brave line, and with all the listeners who are out there and sharing their struggles and sharing their successes and encouraging one another to move forward. As I said earlier, we've been able to expand our telehealth options during pandemic and afterwards. And so people are interested in working with our staff, me or our Michelle, our PA, or our therapist. You can get in touch with us at www.drstracks.com, and our staff will get back to you with all the information you need to know. And if you're interested more in the work that Anna is doing and her approach, there's information on her website, which is annaholtzman.com. You can find this recording and all our previous episodes at Curable and my Hope for Healing landing page, which is curablehealth.com/hope for healing. And you can sign up for our office newsletter and get updates about next episodes and everything else going on in practice. I'll be back on Wednesday, April 13th at 5 p.m. Central Time to talk with mind body physical therapist expert Charlie Merrill. So I'm super excited about that conversation. I hope everybody can join us. And until then, I hope everybody has a great evening and stay safe and healthy. With that, I'll say that everybody hopefully will have a good night.
Good night.